Subscribe to our YouTube channel and press the bell icon to get the latest updates.
I'm with Dr. Navin Dang, one of Delhi's largest private path labs, and I'm in your office. Dr. Dang, welcome so much to ThePrint. We're both wearing masks and I'm wearing gloves, responding to the seriousness of the COVID-19 outbreak here in India. Dr. Dang, tell us first of all, how do you, as a private path lab practitioner, how do you see the situation?
Thank you for inviting me for this talk show. Well, it was about just over a month back when we all started getting prepared to face a certain scenario. And now we still, I feel, haven't reached stage 3. The number of cases are increasing, no doubt. But I think in my optimistic view and with the number of tests which I have done and what the figures from the private labs are coming out, the positivity rate is not too high. It's about just 3 to 5%.
3 to 5% of what?
Of the sample which have been tested.
And what percent are being tested?
Beg your pardon?
So in the last 1 week, private labs are now testing.
Right.
So approximately, if we have 1,200 odd positive cases in the country, what percentage of that would private labs have tested so far?
Well, I can comment about my own self. I have tested about 125 odd samples. Why I refrained from testing was because there was a short supply of kits, short supply of the other ancillary equipment required to do the testing. But since yesterday, I think the things are smoothened out. I see every day a certain improvement happening. I got significant number of kits yesterday, which will tide me over at least for 1 week more. I managed to get some PPEs also. I managed to get
protective gear.
Personal protective gear. I managed to get some viral transport media also. I've been promised that today I'll get more supply of swab sticks also. And the government has been very proactive in seeing that we are getting whatever we want to. But still, I have restricted the number of patients who come to me. I am only strictly following the ICMR guidelines in which they've defined what are the patients to be tested. So the number of patients tested is limited because of the obvious reasons which I've expressed to you.
Right.
But I'm quite sure that if we open up to more, we may pick up some more patients also. But even the high risk patients which you have tested, they are in the range of about 3 to 5% positivity only.
So do you think we need much more testing?
Well, 2 points of view. As far as I'm concerned, and as I've been saying in the media otherwise also, that test. It is extremely important to scale up our testing ability and the number of patients which we test. The simple reason being that what is the worst case scenario? That we'll waste a certain number of tests.
Yes.
We'll test more patients than what is required. But if we pick up a few handful of patients who are positive, they can immediately be isolated out and prevented from spreading the infection to the others. So one is this. Number 2 is that we have to absolutely increase the social responsibility of the patients. For the again very simple reason being that we are seeing that so many patients who are testing positive have escaped from quarantine and are wandering here and there spreading the infection. Like what we experienced few days back in Nizamuddin and what we experienced.
Exactly. Just 24 hours ago in the Nizamuddin Basti, you've had a congregation of about 1,500 people.
Yeah. So that is my humble request to my countrymen to be extremely judicious and careful. It is not the responsibility of the press, or not the responsibility of the government, not the responsibility of the doctors. It's a collective responsibility of the entire country that we all work and understand what we're supposed to be doing.
So are doctors, most healthcare workers, doctors like yourself, who come into contact with samples, with patients, what is your advice to them?
One is that we chose this profession. We are a part of this profession. We are actually the foot soldiers. Like I said that in 1971 war, we knew enemy, we could identify the enemy who were there in front of us. That was when the war took place. But here we have an enemy which we cannot recognize. We do not know where it will be attacked from. You have walked in, any other person walks in, we do not know. Or me for you, you for me. Anybody carrying the infection, transmitting it on. So we have to be extremely, extremely careful. But as far as medical profession is concerned, as far as the healthcare personnel are concerned, they cannot avoid the duty of maybe collecting the sample and doing the tests. Or examining a patient. It may be a pulmonologist, it may be internist, it may be a pathologist, it may be microbiologist, it may be technician. We can't shrug away responsibilities. So my advice is that we all have to look after our own selves. We have to see to it that they're very well protected. when we are examining the patient or doing the test or collecting the samples. And because if the frontline soldiers fall, then the whole country crumbles.
Dr. Dang, just a couple more questions. How do you test? How do you take a sample?
It is a nasal swab and an oral swab, which you call nasopharyngeal and oral swab. We tell the patient to open the mouth after protecting ourselves properly. We tell the
So what do you wear when somebody
we
goes?
are wearing something like a personal protective equipment, personal protective gear. And once we take the sample, just to see that naturally when we take a throat swab, the patient tends to gag a little bit and cough. And that saliva which comes out can directly infect the person who's taking the swab.
I see.
So we have to be extremely careful about doing that. We wear a headgear, we wear goggles, we wear double masks, N95 masks. We wear a full gown which covers it from head to toe, which wear gloves. We should not be wearing any rings or watches or anything like that. And then we wear till the foot covers, everything that is there. And with every patient is very carefully taken out. Then it is put in a bag and sent for discard. We have tried our best to see that as far as our lab is concerned, everything has been made online in the way that even the payments, booking, etc. online, so that when the technologist goes to collect the sample, there's minimal interaction with the patients or minimal interaction even with anything surrounding in the patient's house. So try and see that everything goes online. This may restrict the number of patients which you get, but our paramount duty is also towards our personnel who are doing that.
So this technologist goes to the house of the patient?
Right, ma'am.
People don't come to your lab?
We are not allowing that because here there are other patients also who will be coming. There may be immunocompromised patients who are coming. We cannot endanger the lives or health status of the patients who come out here. So we have devised a model where we book online and our technologist goes to the patient's house to collect the sample. As you must have seen when you walked up, no, no, there's no patient suspected of any respiratory problem whom we are allowing to come out upstairs and give the sample.
So there are two tests you're saying. One is the oral swab.
And a nasal swab.
And what does that involve?
The same thing that we just put an nylon swab inside the nose and take a scraping.
And does it go deep inside?
Not deep inside, reasonably enough for us to take the sample from the nasal mucosa.
Right. And then the testing is done here and you have all the equipment and you have the reagents, because there was some concern that you didn't have.
It requires a biosafety level area. It requires reagents. It requires equipment. And most important, trained manpower. And last but not the least, educated and proper waste disposal system.
And you have all of that?
Yes, of course.
But you were not prepared for COVID, so how did you get all this?
No. Interestingly, we are very well prepared for it. We're not, because preparation started in 2009. 2009, when swine flu came, we were not prepared. And that time I remember being called by the then Chief Minister, Ms. Sheila Dixit, who told us that the private sector has to be involved. The private sector was very proactive, and that time we had no clue. But within a few days, weeks, months, lots of us got absolutely trained about it. And since that time, last 10 years, H1N1, as we call it, has become quite a part of our country. Every year or every second year, we get a few cases, spurt of cases. So because of that, we were well prepared for it. We had the equipment, we had the infrastructure, because same equipment, same infrastructure is used. The reagents are different.
I see.
The reagents are different totally, but the infrastructure is the same.
So the same goggles, the same headgear, same everything?
Yes, everything.
And how would you compare, you talked about swine flu in 2009, 10 years ago, 11 years ago. How would you compare what happened then and now?
Well, now, as far as we are concerned, we are better prepared. We are more aware. But the panic this time has been more because of the increased number of deaths which started from Wuhan. Because
from
Wuhan. Yeah. And immediately it spread to Korea and to Italy, etc. That time, all the European countries were not that much involved, as they got involved this time. US, which was never at that time considered to be as a major hub, has become one of the major hubs where the disease occurred. And of course, with the increased amount of so-called availability of communication through our doctor WhatsApp, everybody is sending information here and there.
Right.
So which is to some extent good, but to a large extent I do not, I call it bad, because lots of wrong information is also disseminated through this.
So as a pathologist, when you look at this particular strain, the COVID-19 strain, is it different from what we have in India to what there is in the rest of the world?
Too early to say. Looks the same, because the gene sequencing which has been done by NIV matches with the one which is there all over the world. And of course, there are mutations happening all over the world. I do not know how this progresses, but at the moment, I can call that the strain is the same.
And how do you then see, can you make any projections? Would you like to make any projections on how this is going to pan out?
Beg your pardon?
Any projections on how this is going to pan out? Because a lot of people are saying that infections could be very high, mortality rates could be high. On
the other hand, I'm pleased to say that in spite of the fact that it's such a highly densely populated country, there have been not so many reported cases as we expected. Was it because of the first proactive action taken by the government? Was it by the media who created so much awareness? Was it by the fact that things were made available soon? Or there's something that was preventing the Indian population from getting infected fast?
What is that something?
I do not know.
So it could be any of the...
They're only hypotheses. Of course, I admire the immediate steps being taken. Never ever in the history of our country, the whole country has been put into a lockdown. And people may be suffering, yes. People say that there are going to be more economic problems, the health problems. But I'll not go into those. But say that, yes, because of the lockdown, I'm quite sure that definitely the country would have benefited.
So the fact that the migrants, thousands of people have left big cities like Delhi and gone to the villages, are you worried that they may carry the virus?
That's a major source of worry. A major source of worry. That when they are going from here and they're going in groups without any social distancing, they may be carrying the virus with them and taking it to the interiors of the country.
The sample that you test in private labs like yours is quite expensive, 4,500 rupees.
No, I call it expensive. No, I call it absolutely inexpensive, because the cost to us is more than 4,500. It's a part of a CSR activity. We worked, all the labs came together, sat on a table with ICMR and worked that how much will it cost. It was costing close to 5,000 per sample testing. But we decided to have, for the sake of this emergency situation, that we fix a price of 4,500. This is not even a break-even price.
Okay. So your last piece of advice to the viewers of ThePrint, what would you say?
Well,
in this interview,
understand your social responsibility. See to it that if you are not feeling well, get yourself tested. Do not take any chances. Follow the government guidelines. Follow the ICMR guidelines. And see to it that you create awareness about it. See to it that you're fully socially responsible about what is happening, and see to it that you do not become a part of the system where the rates are increased of the supplies for personal needs. It should be that everything should be made available to the medical fraternity, to the public, with an open heart. This is the time for us to work for a country, like what I started by saying, this is a war.
Right.
And all Indians, every individual is a warrior, and we have to see to it that we win this war.
Absolutely, the last question. You're wearing an N95 mask. I'm wearing a very simple surgical mask. Is that enough?
Well, I think as per the government guidelines issued yesterday, N95 is more recommended now. Though a few days back, it was said the surgical mask was fine. Even I was wearing a surgical mask a few days back. But if you see yesterday's guidelines, they say that N95 is much better. They say, I do not remember which country they're talking about. I've forgotten. They said that, I think they were some European country where the whole onslaught of coronavirus has been prevented because everybody is wearing a mask all the time. Even they step out of the house, even they step out of the gate, they're wearing the mask. And I think N95 mask now, as per the revised advisory, is more indicated.
Dr. Dang, thank you so much for speaking to ThePrint, for your advice, for your analysis, for your recommendations. Thank you so much once again.
Thank you, ma'am.
This is Jyoti Malhotra for ThePrint. Please consider the seriousness of what Dr. Dang just said, and we hope you will stay safe, stay healthy, and subscribe to ThePrint and keep watching and telling us what else we should do, what kind of interviews. This is Jyoti Malhotra. Please continue to watch our YouTube channel. It's live and buzzing.